Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we help families of critically ill patients in intensive care, improving their lives instantly so that you can have peace of mind, exercise power, influence decision making, and stay in control of your and your critically ill loved one's destiny. Welcome to another video in our IntensiveCareHotline.com's video series. And once again, congratulations for you taking action in getting informed and taking control. Just by you getting informed, you stand out from the rest of the families of critically ill patients in intensive care, and it will give you an edge when dealing with the challenges, difficulties and complexities in intensive care. Our video series will help you to find your voice and will show you how to have peace of mind, take control, be powerful and influence decision making in the jungle of complexities surrounding intensive care. And it will, more importantly, help you to have peace of mind, be in control, feel powerful and influence decision making. In this video, you will discover the guide to the 10 things you didn't know are happening behind the scenes in intensive care that hold you back from having peace of mind, control, power and influence whilst your loved one is critically ill in intensive care. This one is really one of our most important videos in our video series, as intensive care tends to be such a complex, highly political, intriguing and volatile place with very different and difficult psychological dynamics at play compared to other areas in a hospital. Therefore, in order to serve you, the family members of critically ill patients in intensive care, we give you the behind the scenes insight that will give you peace of mind, control, power and influence whilst your loved one is critically ill in intensive care. Because the intensive care team has no interest whatsoever in giving you any insight into the moving parts of a busy intensive care unit. And the intensive care team certainly has no interest in letting you know how they make crucial decisions and how they manage their resources. After more than 15 years intensive care nursing in 3 different countries, I have learned many valuable lessons in intensive care, and I have always been wondering what would happen if families of critically ill patients would know what's really happening in intensive care. I have seen many dramatic situations and circumstances in intensive care where families of critically ill patients have been without peace of mind, without control, without power and without influence. Those families have always been suffering tremendous emotional pain because there just wasn't enough support, advice and resources available to guide them through one of the biggest challenges in their life. Whilst working in intensive care as a nurse in 3 different countries, I have also found that there are 10 distinct things happening behind the scenes in intensive care that hold families of critically ill patients back from having peace of mind, control, power and influence, because the intensive care team is very adept at hiding their true motives from you, especially if your critically ill loved one is in difficult and critical situations, such as they are very unstable and in a very critical condition, or they are in a life-threatening situation, or they may be in intensive care for long-term treatments and long-term stays, or they are even approaching their end of life in intensive care. Those situations tend to be extremely challenging for all parties involved in those situations, are often a massive dilemma for you, for your family and for your critically ill loved one. In those situations, the intensive care team is usually positioning themselves, and they also position your critically ill loved one's prognosis and their diagnosis. The intensive care team's positioning, as well as the positioning of your critically ill loved one's prognosis and diagnosis, often goes way beyond the clinical picture and often goes way beyond your loved one's disease or illness. The fact of the matter is that intensive care is a very complex and sometimes complicated environment where many stakeholders compete for limited resources. They also compete for attention, they often lobby for interests, and many powerful players in the intensive care environment, mainly senior doctors, try and drive their own agendas, which once again go way beyond your critically ill loved one's stay in intensive care. Therefore, you and your family need to understand the dynamics, the politics, the psychology, the intrigue, and the power play that's going on in intensive care if you want to have peace of mind, control, power, and influence. The reality and the fact of the matter is that if you don't learn quickly what's happening behind the scenes in intensive care, the intensive care team will keep you at arm's length, so to speak, and you will be like 99% of families of critically ill patients in intensive care who never have any peace of mind, control, power, and influence. But given that you are here, and given that you are watching this right now, you have already shown that you are different, that you want to belong in that 1% bracket of families of critically ill patients in intensive care who have peace of mind, control, power, and influence. Because you've learned what is important, and you've learned that there's more to it than just meet the eye. Therefore, let's look at the 10 things you didn't know that are happening behind the scenes in intensive care that hold you back from having peace of mind, control, power, and influence whilst your loved one is critically ill in intensive care. Number 1. The intensive care team has already made up their mind about you, your family, and your critically ill loved one, and depending on their perception about you and your family, they will position themselves and your critically ill loved one's diagnosis and prognosis accordingly. The perception the intensive care team has about you and your family has a lot to do how they position themselves and how they position your critically ill loved one's prognosis and diagnosis. You see, many families of critically ill patients in intensive care have no idea what to expect. They have no idea what to do. They have no idea what questions they need to ask. In short, they are paralyzed by fear. I have seen this over and over again in more than 15 years in working as an intensive care nurse in 3 different countries. I can usually see it in their body language. I can hear it in their tone of voice, and I can see their hesitancy by not doing anything at all because they are afraid of making a mistake, or they are afraid of looking stupid when they ask questions. Listen, the intensive care team already knows that you are out of your comfort zone, and the intensive care team can sense if you understand what's really going on or not. Look, if you have been quietly and silently suffering during the situation that you, your family, and your critically ill loved one are in, and if you are feeling intimidated by the intensive care team, you must know that you are not alone, and you must know that this is how most families of critically ill patients in intensive care feel. But just because you are feeling stressed, vulnerable, overwhelmed, challenged, frustrated, and totally out of your comfort zone doesn't mean that you need to carry on that way. If your critically ill loved one is in a difficult and challenging situation, you need to start acting differently. And if you don't start asking the right questions, and as a byproduct, change the perception that the intensive care team has about you and your family from a family who's not in control, who has no power and no influence, to a family who is in control, who is powerful and influential, the reality and the fact of the matter is that the treatment your critically ill loved one is receiving or not receiving very much depends on the perception that the intensive care team has about you and your family. Another very important factor that you and your family need to consider is that the intensive care team's positioning of themselves and the positioning of your critically ill loved one's prognosis and diagnosis also heavily depends on the perception the intensive care team has about you and about your family. if you are like 99% of families of critically ill patients in intensive care who don't have peace of mind, control, power and influence, you will continue to be intimidated by the intensive care team, and you will continue not questioning the intensive care team's positioning and their motives about your critically ill loved one's prognosis and diagnosis. So, your job is to change the perception the intensive care team has about you and about your family by you asking the right questions, by you getting stronger mentally, by you getting out of your comfort zone, by you educating yourself, and by you having a plan and a strategy in how to overcome this big challenge. Also, as a hint, I bet your body language has been really poor since you first went into intensive care. You've got poor body posture, your arms are crossed, you avoid eye contact, you have a weak handshake, your shoulders are slumped down, and your back isn't straight. If you can change all of that, and if you have good body posture, if you can make strong eye contact, if you uncross your arms and you put on a strong display, and I bet the intensive care team will notice. Try it out. Change your body language from a negative body language to a positive body language, and the perception the intensive care team has about you and your family has changed already. Mix that with starting to ask the right questions, and I bet the dynamics start shifting in your favor. The minute you change your body language from "I'm weak, I don't know what to do, and I'm intimidated by the intensive care team, and my body language screams that I have no peace of mind, no control, no power and no influence." If you can change that to "I'm strong, I know what to do, I know what questions to ask, I'm not intimidated by the intensive care team, and I have peace of mind, control, power and influence," that's the minute when dynamics start to change in your favor. It's therefore entirely up to you to change the perception the intensive care team has about you and your family by learning the things you need to learn and by asking the questions you need to ask in order to have peace of mind, control, power and influence. Let's move on to number 2. Many decisions about your critically ill loved one's prognosis, diagnosis and also the perceived outcomes have been made from the minute your loved one has arrived in intensive care and before you have even met anyone. Intensive care is a fascinating environment. That is, if you work there and if your passion is in helping people in need. However, intensive care is also an environment that is so specialized, and it took me years to learn the ropes and to learn the specific skills that are required to look after critically ill people and their families. However, it's also an area that is highly political, dynamic, volatile, where many stakeholders compete for attention and limited resources, and that puts a very different spin on the dynamics in the environment that is intensive care. What you as a family member of a critically ill patient don't know is that many trajectories of critically ill patients in intensive care are already quote-unquote mapped out when patients first have been diagnosed. That is even more true when it comes to situations such as severe cardiac arrests and head injuries in particular. And with anything that is life-threatening and where the intensive care team thinks that a prolonged stay in intensive care might be necessary, and with anything that is likely to take up plenty of expensive resources, including the usage of an expensive and scarce intensive care bed, the intensive care team often presents a doom and gloom picture in order to not give you any false hope, to protect their professional reputation, to keep the power for themselves, because by painting a negative and doom and gloom picture, it's easier for the intensive care team to sell you on a withdrawal of treatment and or a limitation of treatment for your critically ill loved one. On the other hand, if the intensive care team thinks that your critically ill loved one might be a quote-unquote good and quote-unquote interesting case where they can get some new insights about treatments and therapies. They may be more positive, and they may in fact try and sell you and your family on false hopes and promises that only prolong the suffering of your critically ill loved one, where your loved one may in fact die. But the intensive care team thinks that it's a good case to do medical research, and they only prolong the suffering of your critically ill loved one unnecessarily by continuing treatment. Of course, the intensive care team wouldn't tell you or wouldn't be upfront about seeing your loved one's case that way. That's why it's so important that you and your family question everything that is happening, question everything that is being said, and question everything that is not being said. Let's move on to number 3. Many decisions about the treatment, the care, the diagnosis and the prognosis of your critically ill loved one are made in meetings where intensive care doctors and senior nurses are present, and in those meetings they are allocating available, precious, expensive and scarce resources. Intensive care is all about the allocation and management of precious, limited and expensive resources. And once again, if you as a family member of a critically ill patient don't understand and quickly learn what's happening behind the scenes, you and your family and your critically ill loved one can quickly become a political case in the intensive care team's resource management plan, and not so much a clinical case that needs to be cured. Once again, this is not so important if your critically ill loved one is a straightforward case and is leaving intensive care soon. However, if your critically ill loved one is in one of the following situations, such as is very unstable and in a very critical condition, or is in a life-threatening situation, or if they are in intensive care for long-term treatments and long-term stays, or if they are even approaching the end of life in intensive care, then the chances that your critically ill loved one is becoming a political case are tremendously increased, and you need to know and understand that the intensive care team will be continuously looking at things such as the financial viability of your critically ill loved one's case. For example, will the intensive care unit and or the hospital make money or lose money or stay within their budget, and so forth. Also, they will be looking at things like, does the intensive care team have other patients waiting for an intensive care bed, and do they think that those other cases and patients are financially more viable? They would be also looking at things like, do they need to please other stakeholders such as surgeons or other doctors to give some of their patients preference? They would be also looking at things like, does your critically ill loved one fall into a medical research category? For example, is there some medical research that the intensive care team can conduct on your critically ill loved one that attracts 5, 6 or even 7-figure funding? If the answer is yes, then the intensive care team may actually continue treatment even to the point where they may give you false hope, and the suffering of your critically ill loved one may be unnecessarily prolonged by the ongoing treatment. If the answer is no, the intensive care team may suggest to withdraw or limit treatment because the intensive care team doesn't have an interest in putting more effort and resources in your critically ill loved one's treatment, and they may suggest that it's quote-unquote in the best interest for your critically ill loved one, whereas it's quote-unquote in the best interest for the intensive care unit to limit treatment. Another big factor that is highly underrated by families of critically ill patients is the fact that the intensive care team will always have a look at you and your family, and they will size you up, so to speak, and they will always gauge how much they think you know and understand about the situation and about intensive care. Therefore, if you and your family don't ask the right questions, if you take everything for face value that the intensive care team is telling you, you and your family might be perceived as easy prey by the intensive care team. You and your family are also perceived as not having any control, power and influence. Therefore, it would be a lot easier for the intensive care team to drive their agenda if you are not asking the right questions, if you don't stand up for yourself and for your critically ill loved one. As I have said before, the minute you and your family start asking the right questions, the minute you are questioning the intensive care team, the minute you don't take everything for face value, the minute you don't suck up to the intensive care team, the minute you become difficult and demanding, and the minute you stop sucking up to the intensive care team, that's the minute when you will have peace of mind, you will have control, you will have power, and you will have influence. Let's look at number 4. The intensive care team rarely assumes that families of critically ill patients have any kind of knowledge about intensive care, and that's why they position themselves accordingly and therefore have a lot of perceived power. In their discussions, they very rarely mention influence, power or control from families. It's very rarely on the intensive care team's radar. Unfortunately, even though we are living in the 21st century, the medical system is a very antiquated system, with doctors still thinking that they can pretty much get away with anything. You can call it arrogance, and that's certainly part of the issue. But the other issue in this situation is that you and your family, as well as society at large, is still thinking that doctors know best. And yes, doctors and nurses in intensive care are specialists in their own rights, and they have to go through special training. However, intensive care nowadays is such a highly political, dynamic, volatile and intriguing place where often the care and treatment of critically ill patients is all but dependent on the politics, the power play and the things that are happening behind the scenes. Therefore, if you and your family don't question the intensive care team's perceived power, you, your family and your critically ill loved one might be in big trouble. You and your family need to go against the grain, and you and your family need to stop doing what 99% of families of critically ill patients are doing, which is that they don't question and they continue to suck up to the intensive care team. The intensive care team, generally speaking, assumes that you have no idea and no insights about how decisions are being made, and they consciously or unconsciously assume that you and your family just go along with whatever they are suggesting, because that's how society has conditioned doctors over centuries. But listen, you and your family are informed consumers nowadays. You can get all the information on the internet in this day and age, and you can stop putting the intensive care team on a pedestal. Therefore, because the intensive care team is so used to getting what they want, and the intensive care team is so used to not being questioned, that it's in fact a big weakness where you and your family can leverage your level of control, power and influence. Because the minute the intensive care team realizes that you and your family have done your homework, and the minute the intensive care team realizes that you and your family question, that you and your family assume control, power and influence, that's the minute when the dynamics shift in your favor. Let's look at number 5. Continuation or limitation of treatment is heavily dependent on the individual's outlook and interests. Many challenging and frustrating situations in intensive care are often aggravated by some of the doctors and the nurses' individual outlooks and interests in life. What do I mean by that? By that I mean that many doctors and nurses have their own individual opinion about treatments in intensive care, about end-of-life situations in intensive care. They have their own opinions about long-term patients in intensive care, and they have their own opinion about perceived quality of life. Those personal opinions are far more powerful and influential than you think they are. The reality and the fact of the matter is that many doctors and nurses in intensive care have been wrongly conditioned, if not ingrained, that you shouldn't treat a patient in intensive care for more than 4 weeks, or that we shouldn't pay too much attention to provide good end-of-life care, or that we shouldn't pay too much attention to what patients and families want, because we are the professionals and we know what's best after all. And the list could go on. It's an unfortunate reality in intensive care that the intensive care team sometimes has this idea that they are infallible, and therefore their behavior is often quite frankly bordering on arrogance. The reality is that they are not infallible, and the reality is that you and your family simply need to ask for what you want, and you and your family need to simply start asking the right questions. You need to start questioning the intensive care team's perceived authority, and you need to make sure that your and your family's individual outlooks and interests are heard, discussed, and put into place. It doesn't matter whether your critically ill loved one is in intensive care for a long-term stay. It doesn't matter whether your critically ill loved one is in a critical and uncertain situation. And it doesn't matter whether your critically ill loved one is in an end-of-life situation. You and your family have your own individual outlooks and interests. What do you want? Where do you stand? What do you think can be improved in those situations? Keep asking for it, because if you don't ask for it, some powerful individuals within the intensive care team may get their way, and you may find that it's absolutely not what you want for your critically ill loved one and your family. Far too often in intensive care, the intensive care team is getting their way, and families of critically ill patients feel pushed over. Only after it's too late, and then families feel remorse, guilt, and they have a very bitter taste in their mouth about the situation. Your job is to make sure that your interests, your beliefs, your values, and your outlooks on life are heard and implemented into the care of your critically ill loved one. That's what this situation and challenge is all about. It's about you, your family, and your critically ill loved one, and about nobody else. Don't let the intensive care team tell you differently, because most intensive care teams think it's about them, their expertise, their skills, and how smart they are. Nothing could be further from the truth. You and your family are in a unique, special, and often once-in-a-lifetime situation. Once you and your family have become clear that this is what it is, it's so much easier for you and for your family to ask for what you want by not holding back, go for what you want, and as a direct result have peace of mind, control, power, and influence. This is the end of part 1 of this video, so please click on the next video below this one. Thank you.